Hello friends, welcome to our channel. This is Dr. Amol Pathrikar, consultant psychiatrist. In last video, we discussed about what is depression and what are the reasons and risk factors for the depression. In this video, we are going to discuss about the types of the depression and how we are going to manage the depression. So, we'll start with the type of the depression. There are certain 4 or 5 types of the depression. First one is the major depressive disorder, means when you feel persistent sadness of mood and persistent you feel that sadness, loss of pleasurable interest, loss of interest in pleasurable activities, and that will be for years and years, then we say it is a major depression. There are certain another type of the depression, like we say bipolar depression, means when the depression is a part of the bipolar disorder. Okay, there is a fluctuation in moods, there are certain depressive symptoms, as well as some part of the patient it presented with the mania symptom, means hyperexcitability, positiveness, high self-esteem. This thing then we say mania, then it is called as bipolar depression. Third one is a seasonal affective disorder. Seasonal affective disorder means usually the depressive symptom starts at when there is a low light, or especially in winter area and or the winter season. So then we say when the patient feels that depressive symptom, then it is a seasonal affective disorder. There is a postpartum depression, another type. The postpartum depression means certain hormonal imbalance happen after the delivery, or it is a perinatal, means during the pregnancy or after the delivery, and when this depression component came, then we say it is a postpartum psychosis. There are certain premenstrual dysphoric symptom. This is a type of depression when there is a premenstrual, before just menstruation, the female, she start developing some depressive component like sadness of mood, certain mood swings, irritability, restlessness, anxiety. Then we say it is a premenstrual dysphoria or premenstrual depressive component. So these are certain types of the depression. Okay, now how we are going to manage it? So in management, what we actually start with, first, at least we should identify the patients who are depressed. The depression identification of this patient, what we can see in this patient, the people around us, when it is suffering from depression, they start feeling withdrawn, socially the social interaction is gone, reduced, they less participate in other activities. And even what we say in children, then children also they don't participate in any school activities, their scholastic performance gone reduced. So it hampered. There are certain mood swings, tantrums in children also. If we say the depressive component, even the inpatient with severe disorder, major depressive disorder, then patient may present it with certain suicidal ideation also. So these are certain symptoms, and we know then we can diagnose it. Now, what we should be, you should take at least as early as you should take first the help from the professional. Professional means psychiatrist and counselor. The counselors will use a technique, certain techniques of counseling like personal psychotherapy. There is a certain cognitive behavioral therapy. There is a rational emotive behavioral therapy. These are certain types of the counseling and psychotherapy which will help patient to alleviate the symptoms of depression. In severe cases or major cases of the depression, then you need a psychiatrist help, which will start certain good antidepressant medications are there, which will help you to go down this depression symptom. Now, what are the other preventive measures you need to take? Same measures that we discussed earlier also in other my videos. So then you need to do a regular exercise and physical activity. That is most important. Then eat proper diet and nutrition, which will give you a persistent source of energy and keep your mind calm. Always better try to interact with the people, try to interact with your friends and family and share your things with them. Okay, then again, actually you should cultivate certain hobbies that will make you happy. So cultivating certain hobbies will again help you to control this symptom. So these are certain measures to control the depression, and preventive measures, and even the line of the management that psychiatrist will help you. Thank you. So if you feel like this video is valuable, then valuable to you and your family, please like it, share it, and subscribe it. So love and care is a solution for mental health. Thank you.